Welcome to Tech Talks with Kinsoft. It is our absolute priority to take a massive stack of sources, the latest articles, the raw incident reports, and really just extract the critical insights from them.
Yeah, exactly. Our whole mission is to do that heavy analytical lifting for you.
Right. Just connecting the dots so that you can stay well-informed and, more importantly, secure in a digital landscape that is honestly just constantly shifting under your feet.
It never stops moving, that's for sure.
No, it really doesn't. And today, we are setting our sights on a singular, really high-stakes event. We need to rewind the clock just slightly to around March 19th, 2026.
Yeah, this was a major wake-up call.
It really was. So a notorious ransomware group known as DragonForce stepped out of the shadows and they claimed a massive cyber attack on a company called Health Management Systems.
Right, operating at hms.com.au.
Exactly. And they are a major Australian provider of healthcare software.
And, the implications of that specific target are just monumental. Health management systems, they are not a hospital themselves, right? They are a software provider.
Which changes everything.
It does.
Yeah.
We are currently watching the entire industry try to calculate the ripple effects of this compromise.
And that is the core issue for you listening right now. This is not just, a localized story about one unfortunate company dealing with a network intrusion.
But far from it.
Yeah, this is a blaring wake-up call regarding the fragile nature of digital supply chains, specifically within the healthcare sector. When a single vendor experiences a breach, the blast radius extends way beyond their own internal IT department.
Oh, absolutely. The downstream effects are terrifying.
Right. It places countless downstream hospitals, local health clinics, and ultimately vulnerable patient data directly in the crosshairs. So to really understand the threat to your own organization's infrastructure, we first have to dissect exactly what happened to health management systems and, well, look at the adversary pulling the strings.
Yeah, because you cannot defend against an attack if you don't understand the mechanics of the weapon being used against you. The adversary's playbook tells us exactly where our structural vulnerabilities lie.
Okay, let's unpack this. DragonForce didn't just quietly lock up some servers and send a private email demanding cash, did they?
No, not at all. They went completely public. Late last week, they listed health management systems directly on their leak site.
Wow. Just openly claiming to hold highly sensitive data from this healthcare software provider.
Yeah, and they issued a very direct threat: negotiate a ransom or we release everything.
And as of the initial reporting, we don't really have full confirmation from the company about the exact volume of data exfiltrated, right? Or even the scale of the service disruptions.
Right, the details are still coming together. But honestly, in this scenario, the threat alone is a ticking clock.
It's terrifying. Targeting the software vendor instead of a single clinic, it's like a thief stealing the master key from an apartment building's management office, rather than painstakingly trying to pick the locks of individual apartments one by one.
That's a perfect way to look at it. And what's fascinating here is how this incident perfectly aligns with DragonForce's established operational pattern.
Right. They have a very specific MO.
They do. They are specialists, and their chosen specialty is targeting the healthcare sector for what the cybersecurity community refers to as quick extortion.
Quick extortion. That sounds highly predatory.
Oh, it is. It's incredibly predatory.
Break down the mechanics of that strategy for us. Like, why prioritize healthcare over, say, a massive financial institution or a global manufacturing plant?
It really comes down to the unforgiving economics of the healthcare industry. Think about it. If a manufacturing plant gets hit with ransomware and their assembly line halts, they lose revenue.
It's bad, but...
Yeah, it's a terrible situation. Shareholders are angry, but it's ultimately just a financial calculation. But if a hospital network goes offline...
medical staff lose the ability to access patient histories.
Exactly. Surgical schedules, medication dosages. The urgency to recover in a healthcare setting is absolute. It involves human lives, patient safety.
So DragonForce intimately understands this high-pressure environment.
They bank on it. They know that hospital administrators or critical vendors like HMS will feel completely backed into a corner by the moral and operational imperative to restore services.
And that drives them to pay ransoms quickly.
Yes, often bypassing prolonged negotiations entirely, just to resolve the immediate crisis.
Wow, and that strategy is amplified by the fact that they publicly posted HMS on their leak site.
Yeah.
They aren't just encrypting data and halting operations, they are threatening to expose it all.
That is the double extortion model at work. The initial phase is locking the systems to halt operations, right? But the second phase is threatening to dump protected health information onto the dark web.
which introduces just severe regulatory terror.
Precisely. In Australia, a massive data breach involving medical records triggers intense scrutiny, severe fines, and just irreparable reputational damage. DragonForce is essentially turning the regulatory environment into a weapon against the victim.
To maximize the leverage they have to force a payout. That is so cynical.
It's brutal. And their strategy relies heavily on scale. They cannot extort the healthcare industry efficiently if they have to breach one heavily defended local clinic at a time.
Right, which naturally drives them to exploit the digital supply chain,
Yeah.
attacking the central nodes that connect to everyone else.
Exactly.
Here's where it gets really interesting. Let me throw a hypothetical at you.
Okay, go for it.
So if a local clinic out in the suburbs spends millions securing its own internal network, right? They deploy top-tier firewalls, endpoint detection and response, full zero-trust network architecture. Are they still completely exposed simply because they use health management system software?
If we connect this to the bigger picture, the uncomfortable reality is yes.
Wait, really?
Yeah.
Even with all that internal security?
Yes, they are structurally exposed. Look, 10 or 15 years ago, a hospital security perimeter was tangible. It was the physical building, and the servers were sitting in a locked room on premises.
Right, you just built a digital moat around that data center.
Exactly. But today, that perimeter is entirely porous. The perimeter extends to literally every piece of software that hospital purchases and integrates.
I see.
So when a clinic installs software from a vendor like HMS, they are granting that software and, by extension, the vendor, a certain level of trusted access to their internal networks.
Because it requires that access to actually function.
Right, whether that is pulling patient demographics or updating billing records.
So they are essentially provisioning an open, trusted pathway straight through their own million-dollar firewall.
Precisely. And hackers are highly opportunistic. DragonForce realizes there is absolutely no need to spend months attempting to batter down the heavily guarded front door of a major hospital network.
Why bother when there's a side door left wide open by a vendor?
Exactly. They target the softer, perhaps less heavily defended third-party software vendor that already holds administrative privileges or API keys that grant access to the hospital's internal systems.
And if the adversary compromises the vendor, they just use the vendor's existing trusted connections to pivot laterally into the hospital's network.
Yeah, the attack actually originates from inside the perimeter. It bypasses traditional external defenses entirely.
Which means the blast radius of a supply chain attack is just exponential. One successful breach of a vendor like HMS yields dozens, maybe hundreds of downstream victims.
It's a domino effect. And because of that architecture, organizations cannot afford to simply hope their vendors stay secure.
Hope is definitely not a strategy. You need actionable, layered defense strategies to ensure you survive when one of your key vendors inevitably gets compromised.
Resilience has to be engineered into the architecture from day one. The source reports analyzing the HMS incident lay out very specific countermeasures that organizations are urged to adopt immediately.
Let's get into those. What are we looking at?
We are looking at rigorous vendor security reviews, maintaining isolated offline backups, implementing phishing-resistant staff training, actively monitoring networks for anomalous behavior, and establishing robust incident response plans.
So what does this all mean? Now let's tackle the backup strategy first, because we hear about this all the time.
Yeah, it's a critical one.
Like, I want to use an analogy here. It's like having a digital fireproof safe, right? If your house, which is the primary network, burns down, the documents in that completely separate, disconnected safe survive perfectly intact.
That's a great way to visualize it. For an IT-literate audience, we know the basic concept of an air gap, but the reality of implementing it today is incredibly complex.
Oh, absolutely. Because you have organizations relying on continuous automated cloud synchronization just to meet these aggressive recovery time objectives.
Right. And if your data is constantly syncing to the cloud so you can restore it in 5 minutes, you don't actually have a true air gap.
Because if it's connected, the ransomware can reach it.
That is the central architectural tension right there. Organizations think they are protected because their data replicates to a secondary cloud environment every few minutes. But if that cloud repository is constantly connected to the live production network via active credentials, ransomware will simply travel across that connection and encrypt the backup simultaneously.
Wow. So the backups become useless.
Completely. True isolated backups require immutable storage.
Break down how immutable storage functions as a defense against a supply chain attack. Like, what does that actually look like?
Immutability means that once data is written to the backup target, it cannot be altered, encrypted, or deleted by anyone, not even someone possessing the highest level of administrative privileges.
Really? For how long?
For a predetermined period set by the policy. So if DragonForce compromises a vendor, uses that trusted connection to gain domain admin rights on your local network, and then attempts to wipe your backups to force a ransom payment, the immutable storage simply rejects the command.
That is brilliant. The data just remains locked in a read-only state.
Exactly. But implementing this requires separating the control plane of your backups from your primary network's Active Directory.
Right, so if your primary identity provider is compromised, the threat actor still cannot access the backup infrastructure.
Yes, because it relies on an entirely different, isolated authentication mechanism.
Okay, that secures the data payload. But let's look at the human element, because the reports heavily emphasize phishing-resistant staff training.
This raises an important question. How do you actually execute phishing-resistant training in a healthcare environment where the staff are medical professionals operating under immense stress?
Yeah, I mean, they are often fatigued, dealing with life or death patient care. You can't just mandate an annual multiple-choice cybersecurity quiz and expect a triage nurse at the end of a 12-hour shift to meticulously scrutinize the URL of an urgent portal login email.
It's completely unrealistic. Human fatigue will eventually override training every single time.
So what's the alternative?
Yeah. That is exactly why the industry is shifting the definition of phishing resistant. It no longer means training humans to perfectly spot phishing emails. It means deploying authentication technology that resists phishing even if the human makes a mistake.
Okay, like what? Give me an example.
We are talking about hardware security keys, like FIDO2 tokens.
Oh, right. So if a doctor clicks a malicious link that perfectly spoofs the health management system's login page, and they type in their password,
The attacker gets the password.
but they can't do anything with it.
Exactly. The attacker cannot complete the login without physically possessing the doctor's hardware token. The technology provides the safety net that human awareness training simply cannot guarantee.
That makes so much sense. Which brings us to the concept of active network monitoring. If a credential does get stolen, or a vendor's trusted connection is hijacked, we need to catch it immediately.
We have to operate under the assume breach mentality. We assume DragonForce is already inside the house. So active monitoring, specifically endpoint detection and response tools combined with behavioral analytics, looks for the anomalies that occur after the initial intrusion.
Because ransomware attacks don't usually deploy the encryption payload the millisecond they breach the perimeter, do they?
No, rarely. There's a dwell time. The attackers move laterally, they escalate privileges, they map out the network to find the most sensitive patient data, and they slowly exfiltrate it.
And active monitoring flags that exact behavior.
It does. It alerts the security operations center that, say, a vendor service account, which normally only communicates with the billing server at 2:00 p.m., is suddenly trying to access the medical imaging database at 3:00 a.m.
That is a massive behavioral red flag.
And it allows the security team to isolate the compromised segment before the extortion cycle even begins.
Let's shift to the preventative side of this equation for a second.
Yeah.
The reports emphasize conducting rigorous vendor security reviews. But, I mean, a lot of organizations view this as just a compliance checkbox, don't they?
Unfortunately, yes. Sending a massive spreadsheet of questions to a vendor and just filing away their answers.
How do we make this a functional defense mechanism against something as severe as the HMS breach?
A functional vendor security review requires moving beyond self-attestation. You cannot just ask a vendor if they are secure. You have to demand proof.
Like actual audits.
Exactly. This involves requiring independent third-party audits, like a SOC2 Type 2 report, which verifies that the vendor's security controls have been actively tested and proven effective over a continuous period, usually 6 to 12 months.
It's way better than the spreadsheet.
It also involves scrutinizing their software bill of materials.
That is a critical point. A software bill of materials, or SBOM, basically tells you all the open source and third-party components the vendor used to build their software, right?
It is the ingredient list. If a major vulnerability is discovered in a common open source logging library, you need the vendor's SBOM to instantly know if the software you purchased from them contains that vulnerable component.
Wow, okay.
Furthermore, a rigorous review dictates how you manage the vendor's access to your environment. You have to apply the principle of least privilege.
So if the HMS software only needs to read demographic data, you ensure the service account it uses has absolutely zero write access.
And zero access to other databases. You restrict the vendor's lateral movement before an attack ever occurs.
And when all those defenses fail, because let's face it, sometimes they do, when the vendor is breached, the attacker bypasses the monitoring and the network is suddenly compromised. Organizations need robust incident response plans.
The reports note this is the final backstop to avoid paying ransoms.
But an incident response plan cannot just be a dusty PDF sitting on an IT director's hard drive.
Especially because if the network is encrypted by DragonForce, you will not even be able to open that PDF.
Exactly.
A robust incident response plan is a heavily rehearsed operational protocol. It requires conducting regular tabletop exercises that involve not just the IT security team, but executive leadership, legal counsel, and public relations.
Walk us through the mechanics of that in the heat of a breach. What does a robust plan actually look like when the screens suddenly go dark?
First, it establishes out-of-band communication. If DragonForce compromises your email servers and internal chat applications, your incident response team cannot use those tools to coordinate the defense.
Because the attackers are literally watching the chat.
Exactly. You need pre-established secure external communication channels, like a separate secure messaging instance deployed entirely on mobile devices.
That makes sense. What's next?
Second, the plan defines clear decision matrices and authorities. In the middle of a Friday night cyber attack, who specifically has the legal and operational authority to sever the hospital's connection to the internet? Who has the authority to take critical patient care systems offline to prevent the spread of the infection?
You cannot be making those decisions by committee while data is actively being exfiltrated.
No, you need predefined playbooks. And crucially, a robust plan details the exact procedure for failing over to manual paper-based operations in a clinical setting.
Right. Medical staff need to know exactly how to continue triaging patients, tracking medications, and routing lab results without the software they rely on every single day.
The smoother the transition to manual operations, the less pressure the organization faces to pay the ransom to restore digital services. The entire goal of these layered defenses, from immutable backups to vendor reviews to rehearsed incident plans, is to systematically remove the attacker's leverage.
This entire situation just forces us to take a hard, critical look at the architecture we are building. The health management systems breach illustrates a profound tension in modern IT, which honestly brings me to a final thought I want to leave you with today.
I love to hear it.
As we rush headlong to adopt more deeply integrated software, constantly striving to make healthcare, finance, and critical infrastructure faster and more efficient, are the very tools and connections designed to optimize our operations actually becoming our greatest structural vulnerabilities. We are building ecosystems of incredible efficiency, but we are simultaneously centralizing the risk. It's a paradox the industry really must solve.
That's very true. The connectivity that grants us operational power is the exact same connectivity that introduces immense shared vulnerability. Navigating the balance between integration and isolation is arguably the defining cybersecurity challenge we face today.
If today's conversation got you thinking about your own network architecture, the trusted pathways you have granted to third-party vendors, and your organization's readiness to handle a supply chain compromise, do not wait for a prominent vendor to make headlines before you take action. You really need to be proactive. I highly encourage you to visit www.kinsoft.com.au to discuss your security and IT needs with the experts. You can start engineering resilience into your infrastructure today before the ticking clock ever starts.
Thank you for taking the time to explore the mechanics of this threat landscape with us. Stay vigilant.
Keep questioning the systems around you, and we will catch you on the next one.